Hi, I'm Dr. Mike Cedars. Let's talk about facelifts. There was a time, many years ago, when it was considered a status symbol to have a tight pulled look after having a facelift. But those times are long gone, and nowadays people want to look natural. They want to look normal. They want to look younger, yes, and at the very least they want to look like the best possible version of themselves. The normal aging changes the shape of the face. When we're young, the face has what's often described as a heart-shaped, wide and full over the cheekbones, narrow by the neck. Over time, the fatty tissue that pads the face settles. The cheekbone area gets flatter, we get hollow under the eyes, and the fat settles into the lower cheeks, the so-called jowl area. And so the heart-shaped face of youth turns into a square-jawed face in middle age. When we talk about facelift, I should say that we're really talking about treating the cheeks and neck. Commonly, we will combine this with treatment of the forehead and the upper and lower eyelids, but we'll talk about that another time. In order to reshape the face, I like to do this in two layers. We free up the deeper layers of tissue in the cheek and reposition them upwards. So we pull the jowl away from the lower face, leaving it narrower, and we put the tissue over the cheekbones and commonly under the eyes and sometimes back in front of the ears, depending upon a person's needs, and sew it there to restore the desired shape. Having done that, we then redrape the skin gently, merely to display the shape that's been created with the deeper tissues. And as a result, we don't have to create a tight pulled look. The skin is soft. The face looks normal. Working on the neck proceeds along a similar principle. Most people with age lose the sharp angle between the area under the chin and the lower neck. Many people will collect some fat and the muscle tissue becomes looser. So working in two layers on the neck, we first remove the fat and then we put sutures in the muscle layer to help accent and restore the sharpness of contour. And then, as on the cheeks, we redrape the skin over that to show the nice youthful shape underneath. The sutures are around the ears. The sutures, I should say, the eventual scar line runs around the ears. It starts sometimes in the scalp, sometimes at the hairline, runs down in front of the ear, typically, but not always, along the back edge of this little tab of cartilage that's called the tragus, and then down along the junction of earlobe with cheek, where most people have a little crease to begin with. Sometimes it stops right there, but oftentimes the incision and therefore a scar continue up in the hollow behind the ear and sometimes stop at the hairline or occasionally go back into the scalp. So it can be a fairly long incision, but it hides fairly well. Typically there's also an opening in the area under the chin in order to do the work on the front of the neck. Surprisingly to many people, there's really very little pain after this. People will often take codeine for a couple of days, but that's all, and most people are back at work at about 2 weeks. So this is Mike Cedars. Take care of yourself.